My dear students, lots of questions in pediatrics have been asked about trisomies. Last class I discussed with you trisomy 21, and today I will be taking up trisomy 18, which is the Edwards syndrome. Now, to recapitulate a bit about trisomy 21, the Down syndrome, we already know that trisomy 21 is a result of what I can say translocation. And what type of translocation? Robertson translocation of chromosome 21. There is triplication of chromosome 21, and we have those associated features like brachycephaly, like hypotonia, like macroglossia, like the presence of brushfield spots, like the presence of Simon crease, like the presence of sandal grip, like the presence of congenital heart defects like AV cushion defects, the AST, the VST, then the development of Alzheimer's dementia, then also the chances of development of myeloproliferative disorders later on. So today I'll be taking up Edwards syndrome, which is basically trisomy 18. Chromosome 18 is affected, and it has been seen that usually babies who have got polyhydramnios and intrauterine growth retardation, they are at a higher risk of developing this Edwards syndrome. And now, what are the important characteristic features which distinguish this syndrome from other syndromes is that we have got the presence of long cranium. So the cranium is long in these patients or these babies. In addition to that, they have got a prominent occiput. The occiput is prominent. In addition to that, what is present is the presence of low-set ears. So these are some of the cardinal manifestations of Edwards syndromes. In addition to this, they can be having a small receding chin, which we call as micrognathia. Now, another important feature is that commonly noticed is the overlapping of fingers, and overlapping is characteristic that the second and the fifth fingers usually overlap the third and the fourth fingers. Once we talk about fingers in close proximity, we've got the nails. And the nails in Edwards syndrome happen to be hypoplastic. One important classic defect which is always asked from Edwards syndrome is the presence of rocker bottom feet. So rocker bottom feet are characteristic of Edwards syndrome. Now, after that, there can be GIT anomalies, and the anomalies can be just like atresia, intestinal atresias, and the presence of exomphalos. In addition to this, there can be abnormalities in the development of the renal tract, and there can be hypoplastic kidneys, or there can be cystic dysplasia of the kidneys. So these are some of the very important features of Edwards syndrome as far as the renal system is concerned. In addition to this, patients can also present with neural tube defects. So these are some of the important factors and important features which are seen in babies of Edwards syndrome, and they are quite commonly asked. I hope you will be just memorizing these facts, what distinguishes one syndrome from the other. So I hope this class you will be finding beneficial for your examinations. Thanks a lot.